Make a date with our health professionals on the drive with the area gang. Hello, Doc. Hello, Doc.
Hello, Doc. Right, so Dr Emefa Dzide is seated as always. Hello, beautiful.
Hello.
How you doing?
By God's grace, as usual.
We bless God for our lives. Today we are talking about a very important conversation. And when I was given the running order, I was like, wow, getting pregnant. It's been a topic where a lot of people shy away from. People will tell you that yes, nyakopon edi ebama, so on mamia, it's okay. And then people also are even battling, going all the places they can go just to get pregnant. Today, I want us to go straight into it. What are the best ways to increase my chances of getting pregnant?
Okay. So first of all, is having unprotected intercourse without any contraception. Yes. So you would have to be intentional about it. Sometimes unintentionally you get pregnant.
Okay.
But you have to, something, if you want it, you have to be intentional about it. You have to study your menstrual cycle, know when you are should I say in a fertile period. Yeah. Then you should also maintain a healthy lifestyle. You have to have a balanced diet. Okay, and reduce caffeine intake and have reduce the the excess overly processed foods. Yes. So if it's like flour, those kind of foods that you know you cannot produce in your house, yes, then you know that it's overly processed. Yes. Exercise, and then weight plays a huge role. If you are overweight and underweight, that might be a hindrance. Sometimes it affects the hormone levels and other things, preventing you from getting pregnant. Yeah. And you can be taking some vitamins and supplements, especially folic acid, as well as the normal multivitamins and things, and also be doing your regular medical checkups to just be checking your overall state of health. Avoid smoking and alcohol, I always say it. And then monitor your mental state as well, because sometimes being overly stressed can also affect your menstrual cycle and then be a hindrance to getting pregnant.
Sure. Okay. Now, the signs of pregnancy and then that of menstrual cycle or menstruation looks alike. So how would I be able to tell that, oh, these signs I'm seeing is that of pregnancy and not menstruation?
So the most important sign is when you miss your period. So you're expecting it and it doesn't come. That's the most important thing. So basically all the other things that you would suspect, you add it to the fact that you've missed your period.
Sure.
Yeah. So that's the way you wouldn't confuse the two. Once you have missed your period, and then you would have the fatigue, nausea and vomiting, especially in the mornings. But sometimes it happens afternoon and evenings as well. And then sometimes you see changes in the breast. There might be pain and swelling, and you see the areola area getting darker in color. Yes. Urinating very frequently is also a sign. Yes. So once you see those signs, you should do your pregnancy test, urine pregnancy test. But the important thing to know is that the hormone being produced, sometimes they want to do pregnancy test immediately after the intercourse. Or you wouldn't get it that way. Okay. The best way that you would avoid having a false negative is you wait 1 week after the date you were supposed to have missed your period, and then you check. That's more accurate than checking it before the date being overly eager. Yeah.
Okay. I want to ask you this. Sometimes even with our period, sometimes you miss it, and then you see they are here smiling. So if I should check within that period, I'll still get the news that no, this one is a false one, because sometimes you miss it.
Yes.
I don't know how it happens, but then we do miss it 1 week, and then it will show up.
Yes. So it's that's why you wait 1 week after the expected date of the period to be sure that you've actually missed your period. But missing your period, a lot of things go into it. Sometimes it's stress, psychological stress. Sometimes it's your dietary changes. Sometimes if you are ill, so physical stress on the body can also cause those kind of things. Yeah.
Now, what lifestyles can changes or what lifestyle changes can I make to make myself fertile?
Okay. Generally, as I said, just maintaining a healthy diet, avoiding overly refined foods, exercise, and just the same thing.
The same things that you
Yes.
mentioned.
Yes.
All right. Are there any medical conditions that could affect one's ability to get pregnant?
Definitely so. Yes. So especially those with chronic illnesses like diabetes. Unfortunately, if you have autoimmune disorders like SLE, rheumatoid arthritis, that could also be a problem. Some people also have these hormonal disorders of the pituitary, of the ovary. Some people have polycystic ovarian syndrome, which for a lot of people, not all people with polycystic ovarian, but a lot of them, because of the imbalance of the hormones, they also tend to have these difficulties in getting pregnant. Yes. Sometimes people have ovarian insufficiency. Sometimes they go into menopause very early. So like late 30s, they are entering menopause already. And then also if you've had a previous sexually transmitted infections and you didn't notice them, or even if you noticed them and you treated them, they can leave scar tissues in there. Yes. And they prevent pregnancy. Also, sometimes fibroids, if you have a lot of uterine fibroids, that can also be a hindrance.
Okay.
Yeah.
Now, let's come back to normal pregnancy. Now, I've gone through the period. I am fertile. I am pregnant. What are the normal changes or the development I should expect during pregnancy?
Okay, very good. So with pregnancy, there's a lot of changes going on. There's first, I want to group it into three. There's the hormonal changes. Then there is the changes in the blood volume, and then there is the weight changes. So the hormonal changes, the progesterone and estrogen, you know, when the ladies in her period, they are saying she's moody and all those
that.
things. So imagine that those are going to like 2 times, 3 times, 4 times, 5 times their level through the pregnancy. So you can imagine that. So they'll emotional labor, sometimes they'll be happy, the next moment they are angry and those kind of things. Then there's also the increased metabolic rate. So it affects the thyroid hormones as well. So then they have increased appetite, they eat a lot more and all that. Yeah, so that's the hormonal aspect. The increased blood volume. So now the blood volume increases by like 1 to 2 liters within the within the body. Yes. So giving the heart more work to pump, giving the lungs more blood to circulate. Yeah. So sometimes there's a lower BP, and then sometimes people go higher BP. Yes. And then the pulse rate also increases. The lung is overworked because it has more oxygenation to do. Yeah. And sometimes as the abdomen or the uterus is expanding, it can also push pressure on the lungs as well and make it difficult. So you see that pregnant women, small time, they are out of breath. Yes. So those are part of the changes. And sometimes if the uterus is enlarged, it can press on some major veins within the abdomen, and so because of that, the veins aren't able to push the blood up very quickly. So sometimes they get these engorged veins closer to the skin, the varicose veins. Yeah. And then with the weight gain, well, if the baby's weight
and your weight
and the fluid around the baby, the placenta weight, then the increase in breast size. So usually it adds about 6 to 8 kgs of weight.
Wow,
that's aside the other weight gain that they get from eating and all those other things. Yes. So yeah. Okay.
So what are some common pregnancy symptoms when we should even be concerned?
Yes. So I mentioned the things yes already, the vomiting and nausea. But when the vomiting gets profuse, too much vomiting, normally 1 or 2 times in the mornings is what is mostly common. But you have vomiting like 10 times a day, anything you take in,
it's coming out.
Yes. That is a serious, it's called hyperemesis gravidarum. You have to get to the hospital and get some medication for that. Sometimes you might feel a lot of fatigue, too much fatigue. Maybe you are anemic. So you have to check that one out. Sometimes you might have this cramping pain. They say the cramping pain is usually normal and all that. But if the pain becomes too severe or is localized to one specific side, it could be a sign that you might have an ectopic. So you have to be monitoring those things. Don't just take them for granted. But if it's keeping so long, normally a few days, it should stop. But yours is persisting 1 week. You have to get to the hospital.
Okay.
Yeah.
So these are some of the things that should get you to go to the hospital, like fast.
Yes.
And what are the most common or the most important things one can do to ensure a healthy pregnancy? I know parents will tell you that, oh, you shouldn't walk fast, you shouldn't wear heels, you should cover up, all those things.
Yes, well, basically it depends on you and your lifestyle, but the general rule is have a balanced diet, take in the iron supplement, because the blood volume increases.
Sure.
You have to increase your iron intake so that it would boost your HB levels, your hemoglobin levels. And the folic acid is also very important for the development of the nervous system of the fetus. Regular checkups, going to A&C clinic. They always check your blood pressure, they check your urine at every visit. An important thing to the A&C clinic, they do a lot of education. They educate you about how to take care of yourself, and they can be, your midwife can even give you more tailored explanations and then guidance as to what to do with respect to your job and all those things. So the A&C visits are very, very important, especially as you are getting closer to the time of delivery. So it's very important to be going for your A&C visits as well.
Now let's talk about warning signs. What are some of the warning signs a woman should look out for?
Okay, so first warning sign, bleeding. You should not be bleeding if you are pregnant.
People say it's normal. Me, I bled for like 6 months before I even gave birth.
No, it's never normal. It's never normal. There is something we call the implantation bleed.
Okay.
So you bleed a little bit, I think about 2 weeks or so after conception.
Sure.
Yes, but normally you should not bleed. So if you are bleeding, it's a sign that there is a problem. Either the fetus is not well implanted or there's a problem with the placenta. You have to get to the hospital.
Okay.
Lower abdominal pain, very important. You don't take lower abdominal pain for granted. So always get to the hospital. Chest pain is also
pain.
Yes. So aside from the breathing issue, sometimes heart conditions can develop because if maybe there's an issue with the blood flow and all those things, heart conditions can develop.
Sure.
Yeah, and if you're having chest pain, you should get to the hospital and let them check it out. Headache, I mean very severe headaches, and then altered vision. So sometimes you'll be seeing some spots in your eyesight and all those things. That's a sign of preeclampsia.
Wow.
Okay, so once you start having those things, severe headache and those visual impairments, get to the hospital and then let them check you out and see. Also, if maybe you are later on in the pregnancy, usually from 16 weeks going, you should be feeling the baby moving, and that feeling of movement would be increasing as the pregnancy goes forward. So if you've been there for maybe a whole day, you have not felt the baby move, you have to get to the hospital as soon as possible.
No, they say the baby is sleeping.
The baby can't sleep 24 hours. Yes, so you should feel in a day. You should feel some
the
movement.
presence in
yes, yes. Then if you are losing fluid, yes. So if you are losing some fluid, it's not your urine, it's not vaginal fluid, but you see a fluid coming out. You have to see probably the fluid around the baby is also leaking. Yeah.
Now, parents will tell you, oh, if you're pregnant, but they have to cry, they don't go there, don't go and eat it because there. What are some of the foods pregnant women could eat?
Okay, can eat. Oh,
yeah, so that they stay healthy and their pregnancy will also sustain for them.
As for eating, it should just be a balanced diet. I don't want to restrict. I would rather want to talk about what you can't eat. But aside what you can't eat, anything else, just everything in moderation.
Okay,
don't eat
too much of it.
Anything.
All right,
yes.
so let's talk about what you should avoid then.
Yes, so avoid raw food or food that's like cold. Any food you take, it should be a food that you could have cooked and heated in a pan.
Warm.
Yes. So cured meats, so those meats, sandwich meats that they have salami, those kind of things, you have to avoid it in pregnancy. Beef pate and all those things.
Wow.
Those who like baking, you want to be eating the mixture before you bake it. The raw egg in it, not cooked, is also dangerous. So don't eat raw foods. Unpasteurized milk, smoked fish, and those kind of things. Make sure you've cooked it again in your house before you eat
it.
Yes, because you don't know what has gone on whilst they were selling it, how many days it has been out. Some of these things are dangerous, and especially more dangerous for the pregnant woman. Yeah. Herbal teas. Some of these herbal teas, you don't know what are in them. Yes. So please avoid these herbal teas. You can take teas that you know what exactly it is. Chamomile tea, peppermint tea, those are fine. But when they tell you this herbal preparation, herbal tea, please avoid those kind of things. Those who like eating meat and all those things, liver.
Don't eat it.
Don't eat liver as a pregnant woman.
Wow.
Yes, it's high in vitamin A. I know they want to boost their HB. They think there's iron in it, but it's high in vitamin A, which causes birth defects in the babies.
Oh.
Yes, so you don't eat liver. If you want iron, there are a lot of other foods with iron in them. Yes. As usual, no alcohol should be taken. Reduce caffeine as much as possible. People say don't even take any coffee at all in your pregnancy. And fish, like oily fish like tuna. Yes, sometimes they have high mercury content, so you don't eat too much of them. So you take just a little bit at a time.
Okay. Now let's wrap up with this. Now people are more concerned about their bodies after birth. How will I be able to, would my body change after pregnancy? And what do I do to support postpartum recovery?
Okay. So yes, the body has gone through a lot of changes over the 9 months.
Yeah.
Yes. So you should be able to give yourself time to also get back to normal. Usually it takes, the minimum it will take is about 6 weeks.
Okay.
But some people can take 6 months, as many months, to be able to get back. Yes, to their shape. It depends on how stressful the pregnancy was and the delivery and all that. If they had a surgery, if they had tests and all those kind of things. But usually the main issue is there's pain in the pelvic floor.
Okay.
And sometimes there's weakness, so that they might be dribbling urine and all those things. But those things usually don't last too long.
Okay.
The vaginal bleeding after birth, usually about 2 weeks, the color changes back to the normal, how do you call it?
Color.
Yes. The normal vaginal discharge. The uterus usually takes 6 weeks to shrink back to the normal size.
Okay.
Yes. But the issue sometimes, the hormone levels is very a sharp return back to normal. So sometimes it shocks the women and they tend to have these emotional side effects.
Okay.
They get very depressed and all those things.
That is why they need the support.
Yes, they need a lot of support. So it's not just the stress of the pregnancy, but the hormones also play a part.
Yeah.
So when the woman, you think, oh, she's been fine, and then all of a sudden she's very sad
moody
and depressed.
all that.
Yes, so you have to be watchful of those things. Sometimes it can even cause hair loss. So you have to be careful.
All right.
As usual, good balanced diet should help you to come back to normal. Exercising, you can do the pelvic floor exercises, the Kegel exercises, abdominal wall exercises as well.
All right. Thank you so much, Doc, for coming through again for us today. We are really grateful for your time.
Thank you.
That was Hello Doc with Dr. Emefa Dzide. We'll take a quick breather. When we return, remember that Michael will be here with Sports Daily.